All right, welcome back. So, we've just spent a whole chapter talking about the nutritional needs for the first parts of life: infancy, childhood, adolescence. Now we're shifting gears and diving into adulthood. And really, what better place to start than with a fundamental question? Just how long can we expect this journey to be? You've probably heard some version of this, right? This idea that back in 1900, the average person was lucky to see their late 40s. It paints this really bleak picture of the past, but is it actually true? Let's dig in and find out. Okay, so before we can even begin to answer that, we need to get our terms straight. Because words like life expectancy, lifespan, and longevity get thrown around a lot, but they mean very different things. Life expectancy, that's just a statistical average for a group of people. Lifespan, on the other hand, is the absolute maximum age a human can possibly live. Think of it as biology's hard limit. And longevity, that's just the simple idea of having a long life. So when we talk about that 47-year number, we're talking about life expectancy. And that little distinction, well, it changes everything. Now, with those definitions clear, we can really appreciate the incredible story of the last century or so. It's something researchers call the 30-year bonus. And honestly, it's one of the greatest public health achievements in all of human history. Just look at this chart. I mean, the jump is staggering. From an average life expectancy of 47 to now around 77 years. We're not just talking about a few extra years here. We're talking about adding an entire adult generation to the human experience. Think about what that means. Grandparents getting to know their great-grandchildren. It's completely reshaped our society and what we think of as a full life. So yeah, we've got this incredible 30-year bonus. But where did it come from? The answer is, well, it's a bit of a plot twist. It's not what most people think. And that brings us right back to our original question, that whole myth about everyone dying at 47. To bust that myth and really understand where our 30-year bonus came from, we have to talk about something called the childhood gauntlet. Here's the real story. That 47-year average wasn't low because 40-year-olds were just dropping dead. It was so low because it was being dragged down by the heartbreakingly high number of infants and children who never even got a chance to grow up. Things that we barely think about today, infections, diseases, were often a death sentence for the very young. And this, right here, this makes it all click. If you were born in 1900, yes, your life expectancy at birth was 47. But, and this is a huge but, if you survived that dangerous childhood gauntlet and made it to your 15th birthday, your life expectancy suddenly shot up into your mid-60s. See? The real battle wasn't against old age, it was just about surviving childhood. So, how did we do it? How did we conquer that childhood gauntlet and earn ourselves this 30-year bonus? Well, it wasn't one single thing. It was a massive revolution built on what you could call 4 pillars of progress. Think about it. Public health gave us clean water and sanitation. Better nutrition gave us stronger bodies to fight off illness. Immunizations, I mean, what a miracle, wiped out diseases like smallpox and polio. And then medical technology brought us things like antibiotics. Each one of these was an absolute game changer. Together, they totally redefined what was possible for human health. It's also really interesting to see how this 30-year bonus arrived in 2 separate waves. The first and biggest chunk, about 15 to 20 years, came from just preventing those early deaths, making sure kids survive the gauntlet. The next chunk, the more recent 10 to 15 years, has come from getting better at managing the diseases of old age. It's really a story of 2 very different victories. But this amazing story of progress has a really complicated and, frankly, challenging modern twist. And it leads us to something called the American paradox. Here's the deal. The United States spends way more money on healthcare per person than any other wealthy country on the planet. I mean, by a long shot. So you'd think, logically, that we'd be living the longest, healthiest lives, right? Well, you'd be wrong. The latest data puts the U.S. at 53rd in the world for life expectancy. 53rd. That's the paradox. We spend the most, by far, but we're not getting the results to show for it. So, what is going on? Well, the answer seems to be that we've swapped one set of problems for another. We've largely beaten the infectious diseases of the past, but now we're battling chronic, lifestyle-driven diseases. Things like heart disease, cancer, and stroke. And this is where the focus of our course comes roaring back into the picture, because these conditions are all deeply connected to poor diet, lack of physical activity, and chronic stress. So that leads us with this huge central question for our modern times. We've done an amazing job of adding years to life. The challenge for us now is, how do we add life to our years? That's the real puzzle we'll be trying to solve in this chapter, and we're going to kick it off by looking at the actual biology of aging in our very next explainer. I'll see you there.